In the 1860s, you could survive a harrowing accident, make it to the finest hospital in London, have a successful surgery, and still have a 50% chance of dying within a week. The cause? Ward gangrene or hospitalism. The air in the ward smelled of rot, and surgeons believed it was just the inevitable price of opening the human body. But a Scottish surgeon named Joseph Lister read Louis Pasteur's work on microbes and had a terrifying epiphany: the rot wasn't coming from inside the patient. It was being introduced by the surgeon. Lister looked for a way to kill these invisible parasites before they could enter a wound. He noticed that a chemical called carbolic acid, creosote, was being used by town councils to treat sewage and eliminate odors in cattle pastures. In 1865, a 7-year-old boy named James Greenlees was brought to Lister with a compound fracture. His bone was poking through the skin, a virtual death sentence at the time due to inevitable infection. Lister bound the leg with lint soaked in carbolic acid. Instead of turning black and rotting, the wound healed cleanly. It was a medical miracle. Lister didn't just wash the wounds, he wanted to sterilize the entire environment. He invented a machine that continuously sprayed a fine mist of carbolic acid into the air of the operating room during surgery. Surgeons hated it. It made their hands raw, irritated their lungs, and made the room slick and smelly. They mocked Lister's obsession with things they couldn't see. But the data didn't lie. In Lister's own wards, the post-amputation mortality rate plummeted from 45% to just 15%. The antiseptic system was undeniable. Lister's work revolutionized surgery. He taught doctors to wash their hands in carbolic solutions, sterilize their instruments, and clean catgut ligatures. Eventually, the medical world moved from antiseptic surgery, killing germs in the wound, to aseptic surgery, preventing germs from entering the room at all. Out went the blood-stained woolen coats, in came the boiled white gowns, sterile rubber gloves, and scrubbed surfaces that define the modern hospital. His legacy is even preserved in your bathroom today. The mouthwash Listerine was named directly in his honor. How did antiseptic surgery alter the human lifespan? The birth of elective surgery. Before Lister, surgery was a desperate, last resort gamble. Once infections were controlled, operations could expand from basic amputations to internal procedures, appendectomies, and eventually open-heart surgery. Maternal survival. The application of these hygiene principles to childbirth wards drastically reduced the rates of puerperal, childbed, fever, saving the lives of millions of young mothers. By turning hospitals from death traps into houses of healing, Lister unlocked a massive surge in life expectancy across the globe.